urine LEM test available, while about 1 in 4 staff members had not been trained on TB LEM testing. Further, 1 in 5 healthcare facilities has no access to gene expert testing, a rapid molecular test, either at the clinic or by referral. We call for everyone to be screened for TB every time they go to the clinic. All people living with HIV with signs and symptoms of TB or advanced HIV disease to receive both urine LEM test and a rapid molecular test. Anyone with a coughing or any duration and other high-risk groups, including previous TB patients and their household contacts, to be tested for TB. We call on the state to set ambitious testing targets and to find and treat those who are not accessing care and stop the spread of tuberculosis. Digital chest X-ray, urine LEM, and other diagnostic tools should be used to ensure early diagnosis of preclinical TB in patients. The call to declare TB a health emergency comes at a time when lip service has been paid about the importance of treating TB and ending TB. Yet critical funds have been diverted from TB and HIV services. For an example, in 2021 national budget, an estimated 5.8 billion was diverted over midterm, the next 3 years, despite significant losses in the fight against both pandemics. While the government has a central role to play, we call on all duty bearers, including funding agencies, to prioritize HIV and TB funding in budgeting in order for the state to meet these targets. On human resources, we call for more health workers, particularly those dealing specifically with TB, and more community care workers on the front line of TB response. We know that our clinics are understaffed and overcrowded. Almost 80% of patients interviewed through retreats, they told us that they must wait in long queues to access healthcare services. And we know that overstretched healthcare workers can become stressed and have little time for patients. Poor staff attitudes remains a major barrier to patients accessing to healthcare. Less than half, 4.6% of patients interviewed through retreats have felt that healthcare facility staff were friendly and professional. We note the prevalence in males is 1.6 times as much as with women. Yet the reality is that men are far less likely to go to the clinics to get tested for TB or access other healthcare services. We therefore also call on the government to amplify targeted interventions to reach men. We note with alarm that of the patients in the TB prevalence survey who presented symptoms, 66.6% did not seek care. We therefore call on the state to double efforts aimed at societal behavior change through a radical targeted communication strategy. We recognize potentially powerful role players by other non-state actors in this and commit to assisting as much as possible in this endeavor. TB infection control. 6 simple interventions at the heart of how clinics can be part of turning the tide on TB infection. By following a checklist of good practice, clinics can be safer for patients and staff. Yet very few clinics are actually following the checklist. Through retreats, we found that around 40% of the clinics followed about half of the best practice measures, leaving just under 60% failing altogether. Only 2 clinics succeeded in protecting patients and staff from getting TB at the clinic. For years, we have been calling for checklists of good practice to be adopted. We know it is possible. We have been able to educate people about COVID-19 infection control, to ensure the use of masks in clinics, to screen people for COVID-19 symptoms, to ensure the provision of COVID-19 posters in all South African languages. So these things must be possible for TB as well. The only thing lacking is a political will. Deputy President, we call on government and funding agencies to ensure that all best practice TB infection control measures are adhered to in all clinics and other public buildings. We also urge you to establish a standing committee on TB in Parliament. International level interventions. The state committed itself to targets set in the United Nations high-level meetings on the fight against TB, including on increased financing and prioritizing vulnerable and marginalized population. We call on the government to recommit to these targets to highlight the country's commitment to ending TB. Finally, as TAC, we commit to working with government, funding agencies, partner organizations, civil society, and all stakeholders in order to make TB the priority it deserves to be. We therefore, on behalf of Treatment Action Campaign, on behalf of 7.8 million people living with HIV in South Africa, on behalf of more than 369,000 people who are living with TB, we are handing over this to you, Deputy President.
You must first sign yourself. Then I'll sign. Yes. Sorry?
Can you sanitize you, Deputy?
Okay. Let me sign also.
The Deputy President is currently signing the memorandum by the Treatment Action Campaign. So they will give him the copy of one of the memorandum. Then the President will shortly respond to the statement. Okay, the Deputy President is also signing another memorandum received from the Treatment Action Campaign. Now he's giving back that memorandum to them. He will also now address the protesters.
Ngiyanibingelela futhi. Ya bangifundisa lapha ukuthi sebenza njani lento. Sanibonani? Cha sengiyithethe imemorandum yenu. Ngizwile futhi ukuthi ithini. Manje ke nginominister la ubaba uMkhizi. Ngizobuya la masinyane. Ngoba niyakhala ukuthi ingathi uhlelo lwethu lokuscreena for iTB lusalele emuva. Manje ke ngizobuya ngisebenze nani. Ngisebenze ne-Department of Health sizama ukuscreena abantu. Ngizoqala ngani namhla la. Nonke nimelanga zoniscreena namhla. Yebo. Minister ngizocela ukuthi abonesi balanda izinto zabo. Labantu laba siyabahlola namhla. Yes, injalo. Siqala namhla sizoqhubeka. Anihambi ke. Anihambi. Ngizofuna ke ukuthi banivulele indawo nikhuphuke nibe khona la ngizoba khona mina. Sengiyanibona ukuthi niyascreena. Ozotholakala a positive. iTB izokubulala kuphela uma ungathathi treatment. Uma uzothatha treatment ngeke ikubulala. Ngibonga kakhulu ukuthi nizihluphe nisukume phansi ngoba lokho enikukhulumayo enize la ukuzotshela mina anizikhulumeli nina kuphela. Nikhulumela abantu bonke baseMpumalanga. Ihlanzeni district ke i-district enamanamba aphezulu ngokuya kwabantu abaphethwe iTB. manje kuyofanele sisebenze nani sibathole labo bantu sibascreene bese siyaba initiate ku treatment. Ngibonge kakhulu. Ngizawuhamba nani manje angisanishini. Ngimtholile namhla nizoscreena. Yeah, bese ngiyazi ukuthi bangaka abaphethwe iTB lakini. Ngibonga kakhulu, ngiyabonga. Asante.
Sawubona TP, amandla to the leadership with the project siyakulandela.
Well, that was the Deputy President addressing the people from the treatment action campaign. So they will also go inside now to continue with the program, and he actually just said that they would continue making sure that these people, they get tested for TB, and also they will try by all means to make sure that the people that are here protesting about the treatment action campaign protesters, they will also be tested for TB, and treatment will also be given to people who have TB. The Deputy President also said that TB doesn't kill, only kills if you don't take treatment for TB. But I'm gonna have to hand it over to you guys because we're waking up, going inside the venue where the world out of shape. The World Tuberculosis Day is going to be commemorated.
Tumelo Machogo there, as always, trying to do his best to deliver the story of the moment, and out of breath, Tumelo Machogo there. But we'll continue to take you back to that story. The Deputy President of the country, David Mabuza, getting a memorandum from the Treatment Action Campaign about how the country is handling the treatment of tuberculosis. But this